Hi, my name is Mary Lou Pauly, and I'm the mayor of the city of Issaquah. And today I'm chatting with Glenn Huffman, a Battalion Chief with Eastside Fire and Rescue. Glenn has been spearheading an effort to provide vaccinations to adult family homes in the cities that Eastside Fire and Rescue serves, which also includes Issaquah. So welcome, Glenn.
Oh, thank you. Thank you. I very much appreciate being invited.
I've got a couple simple questions for you, and let's see what kind of information we can provide to our community. I wonder first if you could provide an overview of the program that you're implementing.
Sure. In late December, Eastside Fire and Rescue identified that there was a need in our service delivery area of distributing vaccine to the most vulnerable populations that weren't able to get out to go get one. And so we worked through a partnership with our cities of Issaquah, Sammamish, North Bend, and the Snoqualmie Valley to help identify who those people really are and get out to them. In the meantime, King County Public Health and King County EMS came along with the idea that they wanted to institute some mobile vaccination teams, which really fit right in line with what we were thinking. So we began a trial process of working with our partners to identify the population that most needed it, that couldn't get out of their homes, really. And King County EMS and King County Public Health further defined that to say adult family homes. And so that was our marching orders, and that's the point that we started. And so we trained and got up to speed. We got everybody going, and as last Wednesday, we rolled out to Issaquah, and while not a large number, we were able to distribute about 20 doses of the vaccine. And by Friday, we had distributed almost 100. So in 3 days, we got out to 100 adult family homes and a one-off maybe population that we felt needed it, that couldn't get out of their single-family residence. And that's where we're at. We're still currently going forward, and we have, I think, one adult family home left in our service area that needs to be vaccinated, and that's going to happen on Wednesday.
Glenn, I just can't tell you as mayor how much I appreciate what you are doing, what amazing service you're providing to the community. I can only imagine, but tell me what it's like. What kind of reaction do you get from the folks when you meet them just before they get their vaccine?
Yeah, well, it's truly heartfelt. It's extremely emotional, and it's just an overfilling of joy that you get when you see the faces of our senior members in our community light up when we pull up in the driveway. They're at the door waiting, and they've been so frustrated with the process of trying to figure out how to A, get to it, B, sign up for it, and then to have the fire department show up at their door to give it to them. It reminds me of the days that when I first decided I wanted to be a firefighter, and this is just exactly why. So 27 years later, I have hairs on the back of my neck that stand up with joy and excitement to be able to be part of it.
Oh, Glenn, it's just awesome. I have tears in my eyes, so I will try and refocus here a little bit, but thank you. Why is Eastside Fire and Rescue's mobile vaccination program right now working on adult family homes?
So it's a kind of a tiered system. So we're working with our cities with the Human Services divisions to identify the most vulnerable of the vulnerable, and that really is immobile people that can't get in a car or a bus and go somewhere to get it. The other side of that, King County Public Health has extensive logging or information on where these adult family homes are, and they also dictate where we should be starting. So it's a joint effort between all of us, and we're just trying to do as much good as possible. Unfortunately, we can't do everybody in one day. It's just physically not possible, not in a week, not in a month, but we are doing something to move forward for the seniors and the most vulnerable in our populations. Now, I don't want that to be construed as we don't care or we're not worried about the other populations. We certainly are. And we are going to get to you. We're going to make a difference collaboratively between the cities, Eastside Fire, and the state getting vaccine to us. We're gonna get there. We have to have a little bit more patience, and that's a really hard thing to ask for right now. But boy, oh boy, we have the support of all the city councils, the mayors, the city managers in our service area, just pushing us, going, yay, and thank you for doing it. But again, back to the populations we're serving, it's who we believe that at a state, county, and local jurisdiction level, they're the ones that absolutely need it the most first.
Yes, Glenn, I agree with that. And I do get a lot of questions from those who don't live in adult family homes, but I just want to re-emphasize what you just said. We don't have enough supply to get to everybody now. We do need to be patient. And that is really hard in such a difficult year and with anxiety levels so high, to tell everybody that as the primary message. But thank you for saying that you will be getting, to as many folks as you can as supply increases. Is there anything else you'd like to talk about the program, or even maybe describe a bit what it looks like? You have an aid car or 2 aid cars out now?
Yeah, so we have the ability to stand up 2 teams on a daily basis, and generally we're working from about 8:30 to about 4 o'clock. The vaccine that we get, there's a shelf life of it once it comes out of the cooler, and so we have to return it back to the cooler within a certain time period. But anyways, we're working 8 to 5, Monday through Friday, with our city partners to identify that group and get out and deliver the vaccine. What we've done is we've trained about 6 firefighters to work on either team, and we're not using ambulances or aid cars. We're using vans that we have in our pool, and they have carts with all the equipment and the cooler with the vaccine and ready to go. Every evening, I receive a list from the cities, my partners, to where we're going to go, what adult family homes we're going to go to that day. In the morning, I brief the firefighters, and they head on out, and they take a few extras with them. So there's 3 people on each team. They take a few extra with them to train them, so we have more and more and more. And as we'll hear about in coming talks, maybe with the mayor, that we're looking at opening up a mobile site, a drive-through site. So that's hopefully going to come online, and that's for a different conversation. But we're going to need the same vaccinators, the same firefighters to staff that for our community. So we're kind of tackling this on multiple fronts, and we're excited to be part of it. It really is a blessing to our community.
Thank you, Chief Huffman, for leading this effort. As mayor, I really want to ensure that we have a safe and equitable and timely vaccinations in Issaquah and, in our neighboring partner cities as well. I formed an Issaquah Vaccine Community Partnership in early 2021, and this is working on coordinating with public health, Seattle and King County, having timely communications with our community, and situational awareness with our community partners, such as healthcare providers and pharmacy. There's currently not enough vaccine available, however, to meet demand. And when that changes, Issaquah will be ready. Yes. So if you want to learn more and stay updated on local news, please check in on our website at issaquahwa.gov/COVID-19. Thanks a lot, Glenn.
Thank you, Mayor.